So as we continue to talk about the analysis, it's one thing to say, okay, I've identified student groups that may be experiencing challenges. I've identified some of these areas that we need to focus on. Then it's really important to look at the interventions that we're deploying and to understand whether they're working or not. So I've shared a little bit in terms of some of the work that we do with districts through our program, the Achievement Initiative. And we do check in terms of using an MTSS model of outreach and intervention to see how effective our interventions and strategies are in making a difference. And so that's what's shown here. Many of us are all familiar with the MTSS pyramid. And I want to talk about, again, some of the common interventions and some analytics that we apply to those. So for many of us, if you were not sending communications out around absences, attendance letters, we would absolutely say in the year ahead you should be. They don't have to be punitive in tone. Again, we say they should be positive, prescriptive, proactive, etc. This is looking at the results of Tier 1 communications. This is an actual district partner. I'm not sharing who it is, but this is looking at their attendance and their chronic absences by week. And what we see, because this is for the last school year, we know that as school reopened last year, we started hearing these whispers of this Delta variant, and they started experiencing upticks in their chronic absentee rate shortly after school started. What that little star burst on the screen represents on the September 14th is the first attendance notification was sent by the district using our tools. And then what we see is a slow and steady decline in terms of the ongoing chronic absence rates. So having your Tier 1 communications in place is an effective strategy, and having these types of metrics can help you quantify what's working or not working to see if you need to change the language, et cetera, on what you are sending home to your families. And when we talk about the outcomes of some of those initial Tier 1 interventions, like the attendance notification, we use a term that we made up. So let me define it. It's called our save rate. And the save rate is the percentage of students that don't require an additional intervention after receiving an initial notification. So this is looking at that first unexcused absence notification as well as the first excused absence. Pre-pandemic, our initial save rate was 55%. So more than half the time, if a communication went home to a family, absences stopped. This last year, our average was 46%. I think that's important. It's effective, it's almost half, and I think that most districts should continue to utilize this. This is a strategy that's working, and you can disaggregate this by campus to see if you have any variability, if it's decentralized and the communications are handled by the individual school site. Maybe somebody's communicating more effectively than someone else. And so these are the kind of metrics that you want to apply as you're looking at your data. So for most districts, if absences aren't remediated through some of those calls, text, emails, letters sent home, et cetera, then for students that continue to incur absences, usually for most districts, a Tier 2 intervention would be a SART, right? Getting with that family to talk about attendance. So again, this is looking at an actual district partner. And what we're looking at here on the chart, the bar chart on the left is an actual showing the absences in red 6 weeks before the SART intervention. So the average absences 6 weeks before SART, then the SART taking place, and then the absences after SART. And we see a really dramatic improvement. 73% improvement rate was the actual average for this district. But again, asking yourself, is what we're doing working? Why are we doing SARTs? Are we doing SARTs? Why are we doing SARTs? And do SARTs work? And in this case, for this district, it does. And we do this for each one of their campuses, because the goal is not to say, okay, well, it's not working here. It's to say, well, what's going on at this campus where SART is working? What are they saying and doing? And can we expand that out and support our other campuses that aren't having the same kind of outcome? And so that's what the table on the right is showing, is kind of the analysis, saying who it's most effective for, et cetera. And so again, these are things that you can do in terms of looking at your data, because again, as we're doing things, it's not just to be doing them, it's to get kids to school. So let's talk about where we go from here, right? I hope we've shared some good data and some good ways to visualize the data, some things to analyze. So looking at our different student groups, looking at the interventions that we're applying, you can expand this out. I could exhaust all the different interventions with metrics around it, but understanding that data informs action. And that first and foremost, you need to do an early look at your data. As I said before, the kids who are chronically absent the first few weeks, months of school are going to be chronically absent. So we do what we call a first look report within the first 30 days for all of our districts. And I would absolutely recommend as you open school this year that you can do the same thing also to determine what you need to do, if your processes are working, if putting those codes in place so that you have uniform and consistent tracking, and inspecting what you expect. So auditing the campuses in terms of their taking practices. Do they all understand all the codes mean the exact same thing? And expanding out, what are you not examining right now? What are you not looking at? Become curious about your data. So again, it's the onion for me. I peel back the layers and I always want to ask the why. So doing so will help you then understand what students are missing, what the issues are, or at least to lead you to ask the question for those families as to what the issues are and what's affecting them so that you can match them to the appropriate resources and re-engagement strategies. So it starts now. We've talked about it, but just ensuring that there's a uniform and consistent process. So again, in-service is in just a couple weeks, and making sure people know what all the resources are within your LEA for families that are struggling. So that's another critical piece. Oftentimes we have people who have great knowledge of the procedures in the front school office, but may not know what services are available that the district office is offering. Attendance is a leading indicator. When you focus on the 67%, you get results, and the 5 and 7% will follow. So when we talked about those statistics around course failure, getting kids to school is really the critical piece. Go ahead. Customize how you analyze your data, and again, add those codes. For those that aren't familiar, I listed earlier, and you'll have a copy of this presentation related to the ed code around mental health. And again, that's not a diagnosis. If you're simply tracking, it doesn't mean it's just a code to say that this is an excused absence due to this concern. So look at data by grade, ethnicity, student groups to understand who's affected, match them to resources, et cetera.